Hi, this is Dr. Lee, and I'm here to tell you about this lip augmentation I did on Shauna, who graciously volunteered to do this procedure. Poor Shauna. Hopefully she's doing okay. Today, she'd be day 3 after the procedure. So, here I am doing numbing medicine. I did a little drop on each side. But before this, I did a modified dental block inside her mouth. That's in another video. I didn't want to bore you with that dental block video. So a very small droplet of lidocaine with epinephrine was placed on each side. And here I am using a pilot needle, which is a sharp needle, to create an entry site for a cannula, a blunt-tipped micro cannula. So this is the blunt-tipped micro cannula, and I'm inserting it to do the upper right lip. It's always a little tricky to try to get it through the lip area, and I'm getting some assistance from Francesca, who's holding the area slightly taut so that the cannula glides gracefully, hopefully gracefully, through the upper lip. I'm asking Shauna if she's doing okay, and she says she's doing fine. So far, anyway. And we're gliding that through. And I do most of my injecting with the cannula in retrograde, but I do a little bit anterograde, meaning going forward, so that it doesn't hurt as much, because there's lidocaine inside the syringe of Juvederm Ultra XC that I'm using. And now I'm doing the bottom lip. So I just swing the cannula down, and I will inject the bottom lip in a similar fashion. Shauna has what I call a very natural lip cleavage, and I don't want to poke the cannula through that area because it's a very beautiful natural feature. I try to preserve that feature, and sometimes we call it the keyhole of the bottom lip. The cleavage of the bottom lip sounds pretty cool. And after I do the cannula method on the entire lip, I save 0.2 cc's of filler to work on the vermillion border of the lip for Shauna. That was an area that Francesca and I thought would look very nice to top off the volume that I'm creating with the filler right now. So I am filling the body of the lip using this blunt-tipped micro cannula. I'm doing the same thing on the other side now.
Funny sound going through the skin. At least we got the other side.
That transition was because Elena had accidentally stopped the video and started again, so not much time has actually elapsed between that transition and what you see now. So that wasn't really a time lapse. This is pretty much real time for a lip augmentation done with me and Francesca at Surgical Artistry. And now we're doing the bottom lip. So this blunt tip micro cannula doesn't have a sharp point, so it has a slightly hard time getting through that pilot hole, and some patients can hear a little crunch when that happens, and that does bother some patients, but it is just mainly a noise that the patient hears because it's all connected to the patient's hearing apparatus through the skin, and the ear is actually nearby, so it's not audible to us, but the patients describe it. Now I'm massaging the lips to make sure the body of the lip looks smooth, because that was the area I was filling. And next I will work on the border, the vermilion border, or in this case it's more the white roll, a little bit of the white roll, using a direct needle. This is the needle that comes in the Juvederm Ultra package. And you can see in my syringe I only have 0.2 cc's left. So I'm doing 0.05 cc's of lidocaine not lidocaine, I'm doing 0.05 cc's of
Right over your
of
lips with the bone
Juvederm in
It looks really
each
pretty.
quadrant of the lip. Here I am working down the cupid's
middle.
bow.
Doesn't get blocked as easily.
Very pretty.
And then I like to sort of walk around and see what it looks like, and I'm doing the same for the other side, working on the white roll of the lip.
You can see it fill as I go.
This has to be done very gingerly,
Okay.
and I find that this area doesn't tend to bruise too much if I'm in the right plane. So in general, by doing cannula first for the body, and then this white roll area, it's even more comfortable. But right when you get to the middle, there's a little bit more sensation, because the middle of the lip really has a lot more nerve endings.
All right, running around the table.
When I do my
Just
modified
so-
dental block, I actually could
Oh, was I
add
numbing?
extra numbing medicine in the middle, but I didn't do that for Shauna. And now I'm working on the bottom lip, and you can see Francesca holding a little pressure over an area that was bleeding a little bit, and that pressure helps to reduce bruising. And you can watch the very slight amount of Juvederm Ultra that I'm injecting, and it shows immediately when you're working right at the border, but also the swelling starts immediately as well. And now we're on to our final quadrant. At this point, I want to thank Elena very much for expert camera work. I want to thank Shauna very much for donating her face and energy and time and pain, and I hope she's doing really well. This is being voiced over before I drive to work, and hopefully I'll see Shauna today, and maybe I'll give an update with a picture on how she's doing. This would be kind of the immediate after picture.
I got a massage out.
You saw what she looked like at the beginning of the video, and here I am looking inside the mouth, making sure no bumps. I also want to thank Francesca for helping me throughout the entire procedure and handing me an instrument, and this is the favorite instrument. It's a Q-tip. I'm applying some Vaseline. Vaseline allows me to glide my fingers over the lip, over the different areas of the lip, to feel for any bumps at this point and to massage them out. And the Vaseline's important too, because the lips are dry. After we alcoholed the lips, or applied alcohol on the lips, so this restores some of the moisture, locks in some of the remaining moisture. I recommend patients apply some Vaseline afterwards, or any kind of lip moisturizer, to restore the moisture that might have been lost by doing this procedure. But doing Juvederm, applying hyaluronic acids like Juvederm into the lip does cause ultimately more hydration of the lip in the
Oh my
future.
gosh, they look so
There's
good.
Shauna. She hasn't seen the mirror yet.
Yeah.
But you can see she has a slight smile. She's glad the procedure is over. And now she's looking, and here she is, like, freaking out. Not quite, but she's doing all right.
Good.
Everybody always has an initial reaction,
Yay.
That's lips.
and hopefully she likes it. Thanks for watching.